Ruhonge rwa Kmpdc Níruo Kenya Medical Practitioners and Dentist Council Niruhingite honge 75 cia Urigitani mwena wa Narok Iria Itakinyaníirie Ikiro.
Inspection is geared towards ensuring compliance and is an assessment to ensure that the personnel who are working there, the infrastructure, physical infrastructure, all these activities, together with the operation of the health facilities, comply to the assessed standards that have been put into place by Kmpdc.
Akiaria na andiki a mohoro wa githurima cikaro 255 mwena ucio munene wa Kmpdc Philip Ole Kamwaro Augite honge 6 ni cihingitwo gwa kahinda kanini kuri andu 6 ni maikitio ngono ni undu wa kuhingura mathibitari mugaru na watho.
During the week, we are able to visit and inspect a total of 255 health facilities in the county, out of which 75 facilities have been closed, 6 have been partially closed. We have made 6 arrests and they are being processed through the judicial system.
Ole Kamwaro ataririe ati mubango uyu Urahanika na Unyitaniri na Thirikari ya Kaunti no niguo gutigirira urigitani ni wahanika uria kwagiriire. Oho ni ikitie ritana kuri aikari a mwena uyu maure riboti mangikona kuri na mundu urahura biashara Thibitari-ini mugaru na watho.
So I'm urging all heads of institutions, directors and owners to ensure that your facility is registered, licensed by Kmpdc, and you also engage only those professionals who have been registered, who have been licensed to offer those services according to their scope of practice. Therefore, we are urging also the public to utilize the various forms that we have of ensuring that we find out whether a facility or a doctor, in terms of medical doctor, in terms of dentist, in terms of community oral officer, in terms of a medical camp, in terms of a health facilities, is registered, is licensed by Kmpdc.
Kurigana na Anthony na Munguk, uria ni munene wa ugima wa mwiri Narok, acokire ruhonge rwa Kmpdc gatho ni kurehe motungata guku kuona ni meguteithiriria kuhurana na thibitari cia Magendo.
I'm Anthony Namungu, CC in charge of health services in Narok County, and first of all I would like to really appreciate the effort of Kmpdc coming to Narok through our invitation. This is very handy actually, I can say that. Previously, I think 3 weeks ago, myself, I was summoned by the county assembly to answer or to shed light to a case of a maternal death we had in a private hospital here in Narok called Shepherd. And I would like to really put it clear that it is the mandate of Kmpdc to license and also regulate both public and private health facilities. So Kmpdc came in handy. Actually, we are very grateful because they have even set a satellite office here in Narok County. So we will not be rushing to Narok to seek services for Kmpdc.
Francis Kio Augite ati ni mararuta wira mari hamwe na borithi niguo gutigirira thibitari iria Itakinyaníirie Ikiro ni ciahingo kaimana.
Thank you so much. We thank our Kmpdc for holding our hands in ensuring that our health facilities in the county, both public, private, faith-based, and the practitioners must be licensed to practice.
Handu-ini ha Muthingi TV ni njitagwo Wambui wa Maina.